लेम्यानले पनि भन्न सक्छ होला त्यति त कसैले पनि भनेन त्यो कुरा we can insert anything like a wire or anything and measure it पनि भन्न सक्थ्यो nobody said that do you agree with my answer now yes or no मलाई त्यो भन्न त How many agree with my answer and how many don't agree? You can raise your hand if you agree with my answer. Probing बाट हुन्छ भनेर. Okay.
No, ma'am.
Okay, Anil is saying no. Why Anil?
Ma'am, त्यहाँ internal structure organहरू हुन्छ त्यो बिग्रिन सक्छ मतलब त्यहाँ puncture अझै पनि हुन सक्छ नि त.
Exactly. I know if you insert anything inside the wound track, you may either temper the wound track, or even you may jati depth ho त्यो भन्दा बढी जान पनि सक्छ. You don't know which is the end. I know to measure exactly what is the wound track. I'm glad whoever raised their hands. उनीहरूले raise गरेर पनि I'm glad Anil answered yes, he's exactly correct that we cannot probe. No probing is the first rule for examination of punctured wound. तर जसले participate गरिरहेछ नि I'm not happy with them. Yes or no भन्ने त एउटा answer हुनु पर्यो. No भने कसैले no भन्नु पर्यो. Please interact, okay? यसरी हुँदैन. Friday evening भइसक्यो थाक्यो होला I can understand that but के गर्ने we don't have any option. Okay, so for examination of the punctured wound, initially the clothing should be examined. I know clothing should be recovered. Exactly, timro entry wound, exit wound भएको ठाउँमा पनि if there is any kind of torn part of cloth छ कि छैन, you should tally with that. नै एउटा clothing examine गर्नु पर्यो. External examination should be done. Number of wounds should be detected. Number with external dimensions. I know multiple भयो भने चाहिँ यो एरियामा multiple stab injuries हरू छ अथवा multiple punctured wounds are there भनेर लेख्न सकिन्छ. कति numbers कतिवटा छ भनेर लेख्न सकिन्छ. Each and every wound को dimension नलिए पनि हैन. अब same weapon बाट छ भने at least similar छ भने 80 measurement को breadth width 80 measurement को छ भनेर लेख्न सकिन्छ. And exact location in relation to the two fixed anatomical landmark. कुनै पनि injury report लेख्दाखेरि दुईटा fixed anatomical landmark बाट measure गर्ने अनि त्यसपछि त्यो location लेख्ने हो. अनि internal examination मा no probing should be done. अनि how do you examine the depth भन्दाखेरि it should be examined during dissection. So we dissect the body while doing internal examination. अनि कुन depth सम्म छ? Is it muscle depth सम्म छ, or is it up to subcutaneous tissue level, or is it bone depth? त्यसरी लेख्ने हैन. 8 centimeter अथवा 8 inches त्यसरी लेख्ने हैन कि bone depth. Depth is bone depth or muscle depth, or if it has reached up to any vital organ हैन, त्यो vital organ सम्म छ भनेर त्यसरी हामी depth लेख्छौं. Okay, so please remember no probing should be done. I hope you have understood that. Did we talk about concealed punctured wound?
No, ma'am.
No? Okay. यो सम्म सकेको थियो है?
Yes, ma'am.
So concealed punctured wound भनेर एउटा छ हाम्रो हैन. It's a punctured wound, but since name itself suggests that we don't see that punctured wound easily. Okay, this is usually in case of infanticides. अनि in homicide भन्दा पनि infants if any kind of killing is done to infant less than 12 months of age, we call it as infanticide. All right. So infanticide concealed puncture wound is mostly commonly seen. Normally, external examination, we don't see any kind of injury. But if we look for the wound carefully, then we can see in these part of the body, like frontal of newborn, nape of the neck, axilla, under the folds of the female breast, medial canthus of eye, nasal aperture, and soft palate. These are the areas where punctured wound are seen, and this punctured wound is created by pins or nails in a sano piercing object. And a punctured wound, now what is punctured wound? Like any piercing object, if it's inserted in the body, then we call it as punctured wound. It can be of two types. One is perforated, another is punctured wound. Punctured wound भन्छ, एउटा perforated र अर्को के भन्छ? Next. Anand, can you answer that? What are the two types of punctured wound? Anand, are you there? Dipendra, can you answer that? Whoever is not answering, I'm marking them as absent, even if you send your attendance. Dipendra, can you answer that?
Ma'am.
Punctured wound ko types tha bhayo. You were not present in last class. Dipendra, you were not present in last class. Okay, if anyone can answer that.
Penetrating and perforating.
Okay, what is the difference between the two?
Penetrating
puncture
perforating exit पनि
Okay, एकजनाले आन्सर गर है, सलोनीले आन्सर गर्दा त पहिला सुरु.
Ma'am, in penetrating puncture wound, a weapon penetrates into the body cavity, and in perforated puncture wound, it perforates the whole thickness.
Whole thickness of the body,
Body. Yes.
And other differences, or next one who was answering, Yamuna, please answer that.
Yes.
What are the differences? Yes.
Yes, ma'am. Penetrating wound चाहिँ wound of entry मात्रै हुन्छ अनि perforating चाहिँ पनि निस्के हुन्छ, so wound of exit पनि हुन्छ.
How can you know the entry and exit wound? Continue.
Inverted र everted edgesहरु हुन्छ. Entry inverted हुन्छ अनि exit को ठाउँमा चाहिँ everted.
Okay, it depends upon if the weapon was present in the body or not. And if it's taken out weapon, then everted is the entry wound and inverted is the exit wound, right? So I hope Dipendra, तिमीले अब बुझ्यौ होला के हो last class मा absent थियो भने पनि. Please pay attention in class. These are very basic questions. If you can't answer that, you'll be in trouble. Okay, and my purpose for asking you is just for interaction, just to know if you are there or not. So please handle it carefully. If you're not answering, I will assume that you're not there in class. Okay, causes of death due to punctured wound. It can be present due to this, death can be due to various causes. One of the most common cause is if it perforates the vital organ. Okay, vital organ भन्ने बित्तिकै brain हुन सक्छ, heart, lungs, and liver. All right, if it penetrates the vital organs, then that can be one cause of death. Intracranial hemorrhages, cardiac tamponade, hemothorax, pneumothorax, pyothorax, hemorrhages, vagal shock, injury to larynx, urinary bladder, diaphragm. So further complications like embolism, infection, abscess, septicemia, and peritonitis are the other causes. The next type of sharp force injury is known as chop wound, which is combination of incised wound and perforating wound. But here the weapon is a relatively heavy weapon such as axe, hatchets, and clover. Okay, depending upon the type of the weapon, this chop wound is resulted. And chop wounds को particular एउटा यस्तै किसिमको feature हुन्छ भन्ने हुँदैन, depends upon the type of the weapon. And it is usually, since the force is heavy, it is usually bone depth, and you can even see lacerated margins in chop wound because, again, depending upon the type of the weapon, if the edge of the weapon is blunt, heavy and blunt, then it can produce lacerated margin as well. Okay, so nature of the wound depends upon the sharpness of the weapon, direction and the angle of the blow, portion of the instrument, and a portion of the weapon, difference in the curvature of the tissue involved. If it's struck on the head, kun part of the weapon head ma choko cha. This might depend, since head is circular, whole weapon ko imprint nauna सक्छ chop गर्दाखेरि हैन. So जुन पार्टले वेपनले छोको हुन्छ त्यतिमा मात्र injury भएको हुन सक्छ. So difference in curvature of the tissue involved. So this is again one misfortunate case where this person was badly chopped, mutilated body was recovered, and his head was chopped. Not just his head, you can see other chop injury. These are not stab injury, these are chop injuries in the thorax, and even his part of the hand was dismembered. This is not avulsion, this is dismembered hand. Okay, so these are the examples of chop injuries. Now I'm repeating again, whenever you are studying about injuries or any other chapter in forensic medicine, please go through books that has pictures. One of the very common book where you can see lots of pictures and cases found in Nepal is Death and Deduction. अरु छैन त्यस्तो केसेस डिस्कस भएको बुक छैन नेपालको. So Death and Deduction, it's written by J. Chapman. This person practiced in our country few years back, and he had written this book. Please go through it. Library ma pani cha. Go through it. It will be easier for you to study. All right. So what are the features of the chop wound? It produces ragged, cleft or chop wound, combination of incised and lacerated wound. Weight of the weapon contributes to the ability to penetrate the bone. If it's embedded in the bone and if it is taken out, there is twisting on the withdrawal, which results in splintering of the bone. Defense wound on AQ. Can anyone answer that? What is defense wound?
When being attacked, when you defend jun wound लाग्छ, like if you're raising a hand to protect your face or organ, त्यति बेला चाहिँ jun wound लाग्ने हो, त्यसलाई defense wound भन्छ.
Yes, very good, Kritika. While it is the immediate instinctive reaction of a victim to save himself, either by raising the arm to prevent the attack or by grasping the weapon. So two types of action can be there. Either you defend yourself by just raising your hand, that is known as passive defense, or you want to protect yourself by just grasping the weapon, taking out the weapon from that person. I know, just attack गर्यो, उसको हातबाट weapon निकाल्न खोजेको आधारमा, if you are defending yourself and grasping the weapon, that is known as active defense. Okay, so by just looking at the wound, you can know if it was an active defense or passive defense. But for that, a person has to remain conscious, and he has to know, he or she has to know that she is being attacked. Okay, so involuntary stage ma, athwa if a person is sleeping, unconscious stage ma, if person is attacked, then there's chances that no defense wound is there. That doesn't mean that it is not homicidal wound. Defense wound suggests that the attack was homicidal in nature. So medical legally, it's very important if you see defense wound. Extensor or ulnar surface of the forearm, wrist, back of the hand, and knuckles, fracture of the carpal, metacarpal. These are the areas where you can see defense wound. Why defense wound is necessary? Because it indicates homicide. In females, suggests sexual assault as well. Typically seen defense wound is in the web between the base of the thumb and index finger when blade is grasped. Defense wound is absent if the victim is unconscious, suddenly attacked, or is unconscious. One more type of wound is there, that is self-inflicted or fabricated wound. We have talked about that in medical legal classification of wound ma self-inflicted or fabricated wound. भनेर मेन्सन भएको थियो हैन के हो fabricated wound भन्दा inflicted by one own, usually inflicted by own, usually incised wound हुन सक्छ, contusion हुन सक्छ, burn हुन सक्छ, stab हुन सक्छ, but rarely lacerated wound because it's very painful, and lacerated wound, contusion or laceration is less possible. There is still false contusion wound, fake contusion wound can be produced by other means such as rubbing with the chemicals. I know there is appearance of bluish discoloration. अनि त्यसलाई त्यसरी चाहिँ हामी कन्ट्युज वुन्ड पनि बनाउन सक्छौं fabricated wound ma. Otherwise, incised, burn, or stab injury are common, whereas lacerated is rare. But again, if one cannot produce wound on oneself, he can take help from others with consent. That is also known as fabricated or self-inflicted wound. Why do you produce fabricated wound? Manda? To charge enemy with assault, to make simple injury appear serious. Why do you make simple injury appear serious? To claim more compensation. Yes, what happened? Okay, you are a minor accident, road traffic accident, minor accident, but again, to claim more compensation, he or she can produce more injury. Fabricated wound to make simple injury appear serious by assailant to pretend self-defense. Assailant won't produce fabricated wound produce just to make it appear like self-defense. This self-inflicted wound can be produced by watchmen to pretend defending property, by prisoners to bring charge, by women to bring charges of rape. And these are few examples of fabricated wound. Please go through your books carefully. So that is it about sharp force injury. If you have got any questions up to here, please ask. Otherwise, we'll sign out and sign in back again with another topic.
मेरो सेल्फ इन्फ्लिक्टेड इन्जुरी र त्यो डिफेन्स इन्जुरीमा कन्फ्युजिङ जस्तो लाग्यो। यो जस्तै कुनै पर्सन छ नियर बाइ, त्यसलाई हामी बचाउनको लागि यदि गरिरहेछ भने त्यसलाई केमा गर्ने, सेल्फ इन्फ्लिक्टेड कि सेल्फ डिफेन्स?
के भन त फेरि राम्ररी भन त बा, बुझेन मैले क्वेशन।
मतलब मेरो चाहिँ नियर बाइ जस्तै आफ्नो एउटा बोस छ हैन, अनि त्यसपछि एउटा एम्प्लोइ छ, त्यो बचाउन खोजिरहेछ नि, त्यो अनि त्यति बेला त्यो के भन्छ एम्प्लोइलाई चाहिँ गोली लाग्यो अनि बोस चाहिँ बच्यो, त्यो के हो, सेल्फ इन्फ्लिक्टेड कि सेल्फ डिफेन्स हो?
एम्प्लोइले बसलाई बचाउन खोजेको न सेल्फ इन्फ्लिक्टेड हो न डिफेन्स हो, दुईटै होइन। त्यो अब तिम्रो होमिसाइडल त होमिसाइडल वुन्डै भयो हैन, दो द victim is someone else, हैन, अट्याक गर्न खोजेको एकजनालाई victim अर्को भयो, that is homicidal wound, हैन, but it is not self inflicted nor defense. Defense मा पनि पर्दैन, self inflicted मा पनि पर्दैन।
अनि नन इन्टेन्सनल मा पर्छ त म्याम?
Non intentional
Yes, ma'am.
अब होमिसाइडल भनेर जसले होमिसाइड गरिरहेछ होइन अट्याक गरिरहेछ उसलाई त होमिसाइडलकै पनिसमेन्ट हुन्छ होइन उसलाई त होमिसाइडल नै हुन्छ किनभने उसकोमा मोटिभ छ उसले बसलाई मार्ने भनेर मोटिभ छ उसँग ओके तर उसको एक्सिडेन्टल भयो यो होइन होमिसाइडल र एक्सिडेन्टल भन्न सक्छौँ हामी यसलाई होमिसाइडल पनि डिफ्रेन्ट टाइप्स अफ होमिसाइडल हुन्छ कल्पेबल होमिसाइडल हुन्छ एक्सिडेन्टल होमिसाइड हुन्छ होइन दे आर डिफ्रेन्ट टाइप्स अफ होमिसाइड बट इट इज होमिसाइडल हुन् अनि कुन इन्टेन्सन हो कति सिभियरली पर्सन इज इन्जर्ड होइन त्यो अकर्डिङली पनिसमेन्ट मात्रै डिफर गर्छ okay so this is neither defense nor self-inflicted
Okay, thank you,
all
ma'am.
right okay we'll join in back again with forensic ballistic right